Hello, everyone. Dr. eBay, once again, your platform medical advisor. I know we're all doing very well and keeping safe. Let me say that there are no specific symptoms of body cancer. Body cancers, as somebody asked me recently, you cannot say these are the symptoms of body cancers. It, however, depends on the kind of cancer you are talking about. If it's brain cancer, throat cancer, lung cancer, breast cancers, prostate cancer, colon, or stomach. So it all depends on the kind of cancer you are looking for. And I think I talked about some of the most common cancers we are seeing on weekly or monthly basis, things like cervical cancer. I mentioned on the need of doing your pap smear test from 25 onwards to check for HPV, human papillomavirus. These are the tests we do to check for symptoms of cervical cancer. I mentioned as well about ovarian cancer, and I think I did mention that if you've gone past your period, gone past menopause, and you start bleeding, even if it's once after a year, this could be a sign of ovarian cancer. So you need to get it checked out. I equally mentioned about prostate cancer in men. And obviously, I did mention that if you find yourself passing urine more than 2 3 times at night, you have to get it checked out. You have to contact your healthcare provider. I equally talked about breast cancers. If you start noticing, if you feel any lumps in your breast, any nipple distortion, any kind of rash on the breast that you are not sure of, any lumps in the armpits, either of the axillaries, armpits, left or right, you need to get that checked out. And obviously, this is much more concerning if you have a family history of any of these cancers: breast cancer, lung cancer, prostate cancer, ovarian cancer, or cervical cancer, and indeed any form of cancer of the body. It is much more concerning when you have a strong family history of these cancers. Okay. Having said that, however, there are times when you know that something is wrong in your body. You just feel that no, this is not right. I've not had this before, because the body is made in a way that it works sequentially. The heartbeat goes to. You are meant to eat and digest and evacuate. You are meant to drink water and pass urine. You are meant to breathe. You are meant to walk without getting out of breath necessarily. So there are times when something is wrong in your body. This is not right. I can't walk fast anymore. I get out of breath. I'm losing this stool with blood. I'm beginning to have this pain, stomach pain, chest pain, pelvic pain, or whatever. That is indeed the right time to contact your healthcare provider, because most of these cancers, and indeed any kind of disease at all, if gotten on time, it is better managed. So basically, if, for instance, you feel that things are getting out of norm, out of shape, and being uncontrolled, that is the time you contact your healthcare provider. If you start losing weight out of nowhere, you're eating well, you start losing weight, you start feeling hot and cold at night, you're sweating at night. I mentioned that before in the past. Out of nowhere, you start having stomach pain. After eating, you have stomach pain. It's even worse if you're over 50, 55. So basically, anything at all you're not sure of, any symptoms you are not familiar with that just come up suddenly, that is the right time to contact or talk to your healthcare provider. Okay. So I felt I talk about this because I've had queries regarding symptoms of body cancers. Okay. So once again, we are still in the period of this COVID-19 coronavirus. It is not over yet, but we are within the war. Basically, please let us keep safe, play safe, maintain your social distancing, wear your mask when possible, when out and about. Protect yourselves, your family members, and your loved ones. Keep safe and play safe. God bless. Bye. See you later.